and welcome to the Mental Health Program brought to you by Hope Channel Kenya and myself, Flouridah Afifu. I am a clinical psychologist and a relationships coach, and I'm happy to bring you these episodes that seek to empower you by raising awareness on issues of mental health and also give you information to promote mental wellness. In our last episode, we talked about mental illnesses. And we learned that mental illnesses are illnesses that affect our mood, our thought, and our behavior. We were able to cover much on what causes mental illnesses and what are the risk factors for mental illnesses, and then on what we shall do to respond to mental illnesses. At the end of our show last week, we found out that mental illnesses are treatable. And the only thing that we need to do when we realize that we have symptoms that would show that or suggest that we have mental illnesses is to seek help from mental health experts, to seek support from family and the society, and to be able to talk to somebody that we hold in confidence. For example, we could talk to our ministers in the church, we could talk to members of the family, a friend, or anyone in the faith community. We emphasize that mental illness is just like any other illness, and there is no health without mental health. And so mental illness should be treated with the same seriousness as we do physical illness. When you get mentally ill, it is important that you seek attention as you would when you feel physically ill. Today and in the coming episodes, we are going to make a step to discuss further more specific illnesses that affect us mentally. There are many mental illnesses. We may not be able to list all of them in this series, but we are going to be keen to pick the very common ones that affect people in our society, and we will be dealing with them one by one to bring more specific information, to give you insight and raise awareness on specific mental ailments. Top on our list to discuss is major depressive disorder, that is also or commonly referred to as depression. Depression is classified under a family of mental illnesses referred to generally as depressive disorders. Depressive disorders are mental illnesses that affect us in the body, affect our moods, and affect our thoughts. Common features of depressive disorders include feelings of sadness, emptiness, irritable mood, with somatic changes and cognitive changes that affect a person's productivity and ability to function. These disorders differ in frequency and severity of symptoms. They also differ in duration and the causes. Examples include disruptive mood dysregulation disorder. Disruptive mood dysregulation disorder presents with chronic, severe, and persistent irritability in children that often includes temper tantrums that are inconsistent with their age and are inconsistent with their circumstances. Another example is the major depressive disorder that is referred to as depression, and we are going to look at this in more in-depth just in a while. There's also persistent depressive disorder, otherwise referred to as dysthymia. This manifests in an ongoing low-grade depression or irritable mood that lasts for at least 2 years. Another important one that I would like to mention is premenstrual dysphoric disorder. This is characterized by mood changes and irritability that occur during the menstrual phase of a woman's cycle and goes away with the onset of the menses. There are also substance-induced depressive disorders, which are depressive disorders that manifest with symptoms that develop after the use of a substance or a psychoactive substance, or when one is withdrawing or after exposure to a medication that would cause depression. So let's talk a little bit more about depression. The word depression has been used to refer to feelings of sadness and lowness, even when one is not ideally sick with depression. Depressive feelings as a result of our experiences or situations such as loss, divorce, disappointment, or a traumatic experience are acknowledged as feelings of sadness in reaction to our circumstances, but are not considered as disease. These are normal reactions that are not associated with any disease and are expected to ease as soon as one is able to adapt and learn to continue going on with life. But when these feelings are persistent and the feelings of sadness are intense for extended periods of time, then one may be considered to be suffering depression. Depression causes feelings of low interest in activities that one previously enjoyed. Symptoms include depressed moods. This is marked by extreme and intense sadness, sometimes tearfulness, emptiness, and a sense of hopelessness. Another symptom is diminished interest or loss of pleasure in activities that initially would be pleasurable to an individual. A good example is when you probably enjoyed singing or participating in church activities. When depression comes, then one may have diminished interest and lost pleasure in those activities that they once enjoyed being part of. Depression may also come with sleep disturbances. This would mean that one sleeps either more than usual or less than is expected, or at times completely unable to sleep. Tiredness and lack of energy is another symptom of depression. A person suffering depression may feel tired to even do simple tasks. If you're living in your house and your routine is that you probably clear your dishes every evening or carry out simple activities to put the house in order, when depression sets in, you'll find that you may notice your inability to do certain tasks, but you're completely unable to push yourself to be able to carry out those tasks. Depression may also manifest in significant weight change. It's either weight gain or weight loss, depending on if the depression causes an increase in cravings for food or causes reduced appetite in an individual. Another symptom of depression is diminished ability to think or concentrate. And this would result into indecisiveness, slowed thinking, and sometimes memory problems. We also talk about psychomotor agitation or psychomotor retardation. This is about body movements. Sometimes you'd find yourself with increased body movements even when it is not necessary. And other times, depression may make you become more slow in movement. You might not recognize that you are moving slower, perhaps when we consider your walking pace or your pace of doing things. You might not notice that you're staying still more than is usual, but when you look at yourself, probably in a video or when somebody else looks at you, they will be able to notice a slowness of body movements in you. Depression also brings feelings of worthlessness and guilt, fixation on our past failures and self-blame. Frequent and recurrent thoughts of death is also a major symptom of depression. Suicidal thoughts are associated with depression. Suicidal attempts or actual suicide are associated with depression. It is important to note then that for many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationships with others. In depression, emotions are usually inconsistent with circumstances. Some people may feel generally miserable and unhappy without really knowing why they feel so. And there is nothing they can do to be able to experience happy emotions. A person with depression may not have all the 9 symptoms, but when 5 symptoms are present at a time, with one of them being depressed mood or diminished interest, then that means, or that is a strong indication that you may be suffering from depression. And therefore it is important that you respond by seeking help or by seeking social support. In children, depression may present with irritability. They may be easy to get to anger. They may be clinging. A child who has gained some form of autonomy may regress and start being so clingy on the parent or the primary caregiver. A lot of worry. They also present with aches and pains that are with no physical basis, like stomach pains, pain in the head, or pain in a particular part of the body. Sometimes they may refuse to go to school, even if going to school initially was a fun thing to do. And being underweight could also be an indication of depression in children. In teenagers, depression may also manifest through sadness, irritability, negative feelings and worthlessness, quick to anger or poor anger management, poor performance in school or poor attendance of school sessions, and also consistent feelings of being misunderstood and being extremely sensitive of whatever goes on about them and in their relationships with their significant others. Depression in teenagers also commonly manifests in the use of recreational drugs or alcohol. Teenagers suffering depression may also suffer eating disorders or sleeping too much or sleeping less. Self-harm is common with teenagers suffering depression. Loss of interest in normal activities, just like in other situations, and of course avoidance of social interactions. When it comes to older people, it is important to note that depression in older people often goes undiagnosed and untreated in older adults, and they may feel reluctant as individuals to even look for help. Depression is not a normal part of aging, and it should not be taken lightly. In older people, symptoms may be aggravated and may include memory difficulties and personality changes. Older people suffering depression report pains, physical aches, probably headaches, or aches in different parts of their bodies. These aches may sometimes be severe and difficult for them to manage, and there may be need for them to seek medical attention, and other times they would self-prescribe painkillers for themselves. Fatigue is common with old people suffering depression, loss of appetite, sleep problems, and loss of interest, even in attending social activities. Suicidal thinking is paramount with depression across all ages. Old people suffering depression often prefer staying at home rather than going to socialize or do anything that is new. The risk of disability in old people increases with only one symptom of depression. And by treating the symptoms of depression that an old person manifests, then the risk of disability is also reduced. So what causes depression? The first cause involves brain chemistry. The brain is the part of the body that is in charge of the entire body. And when brain chemistry is altered, either by use of psychoactive circumstances, either through genetical predisposition or traumatic brain injury, then depending on the part of brain that has been affected, brain chemistry might be interfered with. And when brain chemistry is interfered with, then it is possible that one may suffer depression. Genetics is another cause. If you have a relative with depression, or if depression has been an experience in your family, then you are more likely to become depressed. Life events such as early childhood traumas or early childhood adverse experiences such as neglect and abuse would be a risk factor or a cause of depression. Stress due to life difficulties, death of a loved one, or other adverse life experiences such as traumatic events may also be a cause for depression. Isolation and lack of social support could also cause depression. Chronic medical conditions can cause depression. People often have depression along with the other chronic medical conditions such as diabetes, cancers, Parkinson's disease, and other medical conditions. Certain medications, prescribed medication, also have depression as a side effect. And therefore, it is important when you are prescribed for medication to engage with your physician to know which are the side effects to expect and be able to prepare a plan on how you would respond if you experience depression as a side effect of the medication that you're using, either in the short term or in the long term. Recreational drugs such as alcohol and other substances of abuse can also cause depression or make depression worse. And this would be as a result of intoxication with the substance of abuse, or as a result of withdrawal or during withdrawal from that substance. Some personalities are also more exposed to depression than other personalities. If your personality is easily overwhelmed or experiences trouble coping, then depression, then you may find yourself prone to depression. Other risk factors include low self-esteem, being intensely critical about yourself, and personal history of mental illnesses. Depression would be serious enough if it simply produced mental symptoms. But depression can also be the root cause of symptoms that are life-threatening when it comes to physical medical conditions. When a person is ill, depression can dramatically intensify the disease they are suffering from to the point of death. Let's take, for instance, the case of stroke. Depression increases risk of death by stroke by a whole 50%. It increases risk of death by cancers and pneumonias by 50%. And depression also increases the risk of sudden death sudden cardiac deaths in heart attack survivors with up to 150%. Depression is a threat to recovery from a heart attack and increases the risk of dying. It also triples the risk of contracting heart diseases in men. And this risk is independent of other known risks such as smoking, blood cholesterol levels, diabetes, or high blood pressure. It means that depression alone increases the risk of contracting heart disease in men if other risks are not present. Depression is also detrimental to a host of bodily functions, causing shrinking of the hippocampus, a part of the brain that is critical for learning and memory, causing increased levels of stress hormones in the body, and we understand that high levels of stress hormones in the body are detrimental to our health, causing hypertension, aggravating asthmatic symptoms, causing headaches, infertility, and possible increase in seizures in people suffering ailments that have seizures as part of their symptoms, and causing difficulties in controlling blood sugar levels for diabetics. In terms of behavior, depression interferes with learning and job prospects. We have understood that depression causes great impairments in one's functionality. And when you are unable to function to your optimum or as usual and as expected in the right measure to meet your daily obligations, whether in your career or your academics, then you'll find that depression compromises your learning and job prospects. People suffering depression also have difficulties in their relationships, mostly because they are not able to bring themselves to relate cordially with the people in their surrounding, with the family, with their spouses, and with their children, and sometimes because of the disability in relationships or effectiveness in their relationship with their families and their children, they may end up raising children who have problems. Depression increases the risk of alcohol and substances use. Many people use alcohol and other psychoactive circumstances to run away of the issues that cause them depression, or to try and alleviate their depression levels. Unfortunately, when we use alcohol or other psychoactive substances as escape routes for depression, we end up bringing more problem that causes more depression, simply because alcohol and other substances of abuse have a depressive effect, either by virtue of the intoxication in our lives or during withdrawal. Another serious effect of depression is suicidality. Suicidal thoughts, suicidal behavior is a major concern when it comes to depression. Recent reports have shown that the rates of suicide are considerably high, an indicator that depression is a major concern in our community. Suicidal thoughts don't go away on their own. Suicidal behavior does not just diminish. It calls for active support, deliberate steps to be able to resolve whatever is bringing those thoughts or whatever is maintaining that behavior. Now then, having understood depression, what then shall you do in response to depression, either in you as an individual or in somebody that you know and you suspect could be suffering from depression? First is to make an appointment with a doctor or a mental health specialist. A mental health specialist will be able to make assessments and be able to come to a good diagnosis, and also be able to come up with a treatment plan. A psychologist will help you to be able to probe and identify what are the underlying causes of your depression. And when the causes are identified and resolved, then with the help of medication and psychotherapy and social support, your depression can be treated. Another thing that you can do is to talk to a friend or a loved one about what you're experiencing. It helps to share our experiences with the people that we hold in confidence. When we share our experiences, we create understanding of what we are going through, we gain more insight on our situation, and we are able to harness social support. If you think you may hurt yourself or you may hurt someone, then seek emergency intervention. Have the suicide hotlines on your fingertips or saved somewhere on your phone, that when these feelings intensify, then you can immediately reach out for help or take yourself to the emergency unit of any hospital. If you have a loved one who is in danger of suicide and has made a suicidal attempt, seek help for your loved one. Accompany them to psychotherapy or to the emergency room. ensure that this person is always accompanied by someone. If they are living alone, you may probably want to live with them for a while in your house or move and live with them in their house. As we come to a conclusion on our presentation today, I would like to highlight these facts. Depression is treatable. The importance of finding the cause of depression and adequately treating it cannot be underestimated. Depression symptoms must not be ignored, because if they are ignored, then the situations may intensify and may lead to other bigger problems or be a cause factor for other mental illnesses. People who suffer depression can again thoroughly enjoy a life of happiness, be more efficient and more productive if their depression is treated. The management of depressive symptoms usually involves 3 components. That is, social support from the people in our circles, in our community, at our place of work, in our faith families, psychotherapy, and medication. If we have learned anything today, is that depression is real and depression is treatable. Take a step to identify depression in you as an individual and in your family, and take a step to pursue treatment that you may live a productive and more efficient life. This brings us to the end of our show today. We look forward to meet you next week, same place,